So greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe. Let us know what you think. Leave a comment. Today, my guest is Ruby Whalen. Ruby has been a nurse for over 30 years. She has been a bedside nurse in pediatric cardiac intensive care, a cath lab nurse manager, clinical research nurse, and a nurse clinical in congenital heart disease. Throughout her career, Ruby has maintained a passion for nursing education and research and promoting health and well-being. In 2012, she followed her passion for education and assumed the role of nurse educator in a pediatric ICU. In coming back to the inpatient setting, she recognized that nurses across the lifespan of their careers were struggling with burnout, and she began to address this with the nurses she worked with by providing integrative approaches to stress management. Ruby has made it her mission to empower nurses to promote their own well-being and to develop and maintain resiliency. She has an MSN in nursing education and will complete her DNP in nurse education in the fall of 2022. Her doctorate work involves teaching nurses simple self-care techniques they can use anytime, anywhere, to manage stress and promote well-being. She's also a board-certified nurse coach and uses her skills to support nurses and healthcare professionals. She's the founder of Essential Nurse Coaching, which provides life and career coaching, monthly support circles by Zoom, integrative practices, education and retreats for nurses, and a private Facebook group for nurses, which focuses on well-being. Ruby is passionate about nursing in all its forms and is dedicated to helping nurses rediscover their passion for nursing and regain control over their own well-being and careers. She can be reached through Essential Nurse Facebook and Instagram pages, LinkedIn, and by email at essentialcoaching@gmail.com. And this information about how to reach you, Ruby, will be in the description box. So welcome, Ruby. I don't even know where to start with you. You've got so much going on. but I always want to know why people are nurses. So why are you a nurse?
That is the million-dollar question, right? I think like so many other nurses, I had wanted to be a nurse for as long as I could remember. It was just something I wanted to do. Now, I didn't take the straight pathway to it.
Okay.
My first degree in college was actually in history because I thought that I would pursue a route in academia, and I really loved history because it taught us how people came to where they are and what makes us do as a society, you know, what makes us be how we are. So my first degree was actually in history. And when I finished the degree, I took a deep breath and did a little bit of traveling as I tried to figure out what I wanted to do. And my initial passion for nursing just kept coming back to me. So I thought, well, let me just take a diploma program and see if I really like it. It's just 2 years. And if I don't like it, I'll go back to my original plan, which was to pursue a master's in history. But so I enrolled in a diploma program in Winnipeg, Canada, because I'm originally Canadian.
Okay.
And it surprised me that I truly loved it. I truly loved being with patients. I truly loved the whole philosophy behind nursing, and I've not looked back since then. We won't talk about what year that was, though.
That's okay. Whatever year it was closer to this year than mine was, so that's okay. When you talk about, finding that you truly love nursing, the thing I discover with nursing is that it's not one of those things that you can be wishy-washy about. You know, you're either all in or you're not.
That's very true. That's very true.
Yeah. So you became a nurse in Canada, and then what? You moved back to the United States?
Well, I was born and raised in Canada,
Mm-hmm.
so my history degree and my undergraduate nursing was in Canada.
Mm-hmm.
And then I decided, being in my mid-20s and having a flair for travel, that okay, I'll be a travel nurse now that I've got my nursing license. So I got licensed here in the United States and I started traveling and just ended up here. I remember one winter when it was 40 below, one day too many in Winnipeg, and there was a position open in Florida, so I took it. And you see, here I still am.
I see that. And in reading your bio, I see that you really gravitate towards children, huh? And cardiac at that. Any particular reason?
And that was a tremendous surprise for me too, to be honest with you. Even halfway through nursing school, I really didn't think that I would want to do pediatrics. I actually dreaded the pediatric clinical portion until I got there and realized how much I really loved being with children. And even more so, I started to, as a student nurse, take care of patients with congenital heart disease. And then I found that truly, truly amazing and so fascinating. What makes what makes a baby have a normal heart, and what makes a baby have a congenital heart disease. It's just one or two little folds, as it's developing, and there we are.
Yeah.
But the thing I truly loved about congenital heart disease was every defect is different. And even, if you think about a defect like tetralogy of Fallot, there are no two patients with tetralogy of Fallot that have this exact same defect. So there's always something different to be learning and planning for the patients.
Yeah. And that's nursing, and that's the whole thing about it. There's always something different.
Yes.
And so you talk about constantly learning, and so there you are constantly learning, but not just learning, you're also coaching. Why? What made you think that, okay, you know what, these nurses really need some kind of guidance?
So I would say that I have always had a passion for integrative nursing. And I've been a member of the Holistic Nurses Association, I think, since 1992. Now, that's not always been unbroken. I've forgotten to pay a membership, and a month later I realize it, and but that aspect of nursing has always been in the back of my mind, and just the self-development and self-reflection and self-care that comes with that piece of nursing has, to me, always been what the heart of nursing is really about. The bringing the art of our profession and mixing it with the science of it. That's what makes nursing unique from so many different healthcare professions. So I learned about nurse coaching through just my associations with different holistic nursing organizations, and it fascinated me. And I just decided to take a 6-month course in it. And again, I think that I started it going, I'll do this on the side. I'll start up a business on the side, and I'll do wellness coaching. And as a nurse, that's the perfect fit. But what I realized was that I got as much out of learning and the nurse coaching process, I got as much out of it for myself as I did for any clients. Just that when you think about Barbara Dossey's theory of integrative nursing, or the theory of integrative nurse coaching model, one of the 4 components is nurse self-care, nurse self-reflection, nurse self-development. So, putting the responsibility back on ourselves to take care of ourselves I think is something that is very important and is something that is missing within our profession today as well. So in 2017, I became a board certified nurse coach. And like I said, I thought I would do wellness coaching on the side, but what I realized was that I was a unit-based clinical nurse educator at the time in a pediatric cardiac
Yeah.
ICU.
Yeah.
And I realized that these nurses were burnt out. These nurses were screaming for help. These nurses needed to know how to take care of themselves and how to maybe shift their mindsets a little bit and put up some healthy boundaries
Yeah.
for themselves as well. And so I started practicing nurse coaching on into just really informally integrating it into my work as a clinical educator.
Yeah.
And I found that through the nurse coaching training, my communication skills were better. I knew how to ask the right questions that were more meaningful to the nurses. I learned how to do sharing circles. I learned how to ask these open-ended questions that would help the nurses develop the tools for
Yeah.
themselves. And so that's where I took my nurse coaching. So based on that, then I decided, okay, I have a little bit of time, so I'm going to make a shift even within my nurse coaching expectations and really focus on nurses. And so that's what led me to create Essential Nurse Coaching.
That's awesome because that's one of the things I pretty much always ask nurses is what does self-care mean to them? It means so many things, so many different things actually to so many people. And very often, we don't practice it. We think we're supposed to be last on the totem pole. We don't recognize when we're broken or when we're breaking, or we choose not to recognize, or and so we get you talked about burnout, and you get to that point. We didn't need to get to that point, if only there were the tools, you had the tools, or you employed the tools to step in and to recognize what was happening. So I'm so happy you're doing that.
Thank you. Thank you.
I really am. Ruby, what would you say is your greatest achievement so far as a nurse?
My greatest achievement, I would say that being able to help nurses not only in their self-care but also in their own professional development. For example, I recently left a job that I had for 10 years in an organization that I was a part of for almost 27 years.
Yeah.
Because number one, because I sensed my own burnout and that it was time to make a change for myself. Not easy to do and very scary, but you follow, you follow your instinct. But I remember a few weeks after I had left the job, my phone rang and it was a nurse. And she had asked me a while back, she had asked me for my my impression or my advice on a matter for herself. And I didn't give her advice. I put on my coaching hat and I talked her through it because she was trying to make a decision about applying for 2 different opportunities that had come up in nursing, and she was trying to decide which one. And most of the people were giving her advice in one direction, but it didn't. The coaching session that I gave her, the impromptu coaching session, for her, that didn't feel right. So she did this self-reflection, and I didn't know it, but she went off and applied for the other position. And then a month later, she calls me and she's ecstatic. And she says, I just want you to know that that conversation you had with me changed my life. You told me I could do this, that I was worthy, that I had the skill, I had the knowledge. So I took a chance and I applied for the job and I got it. that makes my heart sing. That's when things like that happen. There's no price value on that at all for me.
Yeah. I can imagine that. Listening to you talk about it is giving me goosebumps. So yes, I can imagine how gratified you must have been with that. So, but then what is your big vision? How there are a lot of people who are recognizing burnout within our profession and getting into coaching and thinking about self-care and stuff like that. You started Essential Nurse Coaching. How big do you want to see this get? How much of the profession do you want to see this take over?
You mean that just the concept of nurse coaching within our profession?
Yeah, because we don't, in our educational process, there is nowhere for that for us taking care of ourselves.
I agree, and I think that was also the stimulus for my doctorate project, in addition to trying to find a way to bring simple techniques, to the bedside nurse. I was reflecting on just how much the process of nurse coaching improved myself, my communication, my relationships, how, again, taking care of myself in simple ways. Self-care doesn't necessarily have to mean taking a day off and going to the spa, although that's wonderful too. We, in the reality that is life, that's not always possible. So when I was doing my literature search for my project, I was reading the stories of nurse coaches and how their experiences for themselves were similar to what my experience was. I read a couple of research projects, some published articles out there on how nurse coaches reported those improvements in their own lives. So my idea was, not everybody has the desire or the resources or the time to do nurse coaching, but can I take some of the principles that we do in nurse coaching and bring them to the bedside nurse? Can I teach some of those principles and then provide some very simple tools to sort of support that? And would that help the nurse in her day-to-day busyness, on the floor or wherever her or his practice setting happens to be? And that's how I sort of came to this place with Essential Nurse Coaching.
Well, something you mentioned earlier when you talked about, you mentioned the word boundaries. And I have learned over years just how big and how important that word really is, and how important it is to have boundaries. But as nurses, our mindset is to do for others, and implementing boundaries is not something we're good at. It's not something we're good at. How do you see? What advice would you give to somebody who really needs to set some boundaries, but just does not know how to do that? Because that's hard.
It is really, really hard. And I'm guilty of crossing them all the time as well. So I'm just going to do full disclosure here.
Yes, me too.
But I think that the first step in that is just to recognize it, to recognize how we're feeling, and being mindful of that. Are you coming in for that 12-hour shift? What are, is it okay for you to do that? Or are you coming in exhausted just because you feel guilty? Because maybe that might be good for the organization, but it may not be good for you in the long run if that's a pattern that you're establishing. And, I sometimes I recommend to people, when we think of boundaries, we think of these hard walls, right?
Mhm.
you're not crossing this line with me, or this is as far as I go, or, oh, my wall is up, my shields are up.
Yeah.
I kind of think of boundaries like a nice bright light around myself, so
Okay.
that there's soft edges there, that you can give and take a little bit, but it's not such a harsh and solid thing. So I
Yeah.
think boundaries can be a little bit of give and take, so that some days you might cross that line and go in for the
Mhm.
fifth shift, but you may not do it every week, because you can recognize when your body and your mind and your spirit needs a break too, because
Yeah.
we can't give, we always hear you can't pour from an empty cup, and that's true, but overall, you can't pour when your cup has a whole bunch of holes in it either. It's never going to fill, right? So we
Yeah.
have to recognize when we need to plug the holes and sit out and let some rainwater fill us up.
Yeah. I wonder, we do this, so you spoke about, bringing these concepts and these tools to nurses where they are. How do you think we could go about bringing those same tools to management? Because it's one thing to have it here, but also it would be helpful if you had it over here, so that each can understand what the other is feeling. And right now, as I speak to nurses, one of the things that comes to the forefront all the time is that there seems to be this adversarial relationship almost, between clinicians and the actual clinicians and management, the administration. Between clinician and administration, there's this tug of war going on, and I'm wondering, how can we stop it being a tug of war and a coming together for the common good? I can't go past that.
Yeah, that's a really, really great and challenging question, for sure, Dale. It seems to me, in all of my years working in a hospital, that a lot of our structures, our healthcare structures, are set up so hierarchical,
Yes.
as opposed to lateral.
Yeah.
And I think somewhere along the lines we have to flatten that out a little bit, because our administrators are burnt out and stressed out and trying to meet deadlines that are often unrealistic too. And that trickles down to our nurses, because they've got to bring it down to them and say, you need to pick up your pace, you need to do all of these bundles and this documentation. So it rolls, it rolls down. So I think some of it is systemic, in that we have to change some of the structures, I think, of our healthcare settings. And it's also, I think, can start with some shifts in mindsets, because we know that structures don't change because because of the good of their hearts, right? I mean, structures change when people within them change. So changing our mindsets, and again, I think I would love to see it where our managers and our leaders are a part of our team, but they're a bit more at our level. And the value of the bedside nurse and what that person does is recognized as equally as valuable. We are all necessary, right? The person who cleans the room is just as necessary oftentimes as me as the nurse or the respiratory therapist. We're all very important parts of that. And I think that there's a lot of conversations out there now about bringing more interprofessional education and care to healthcare. Number one, there's white papers out there that show that it improves communication, for patients and patient outcomes, because these, the doctor and the nurse and the respiratory therapist and the nurse practitioner, they're talking to each other because they've had some training together. So maybe, even think about it, in nursing education or in healthcare education, even when we do simulation, we're all in our silos, right?
Yeah.
The medical students train by themselves, the nurses train by
Think
themselves, but that's not the way it is in real life.
Right.
So I think that even just starting by changing how we educate a little bit, you know, having more of those interprofessional scenarios, having some classes together maybe at some point,
Yeah.
you know, would help, I think, to soften those silos a little bit more.
Yeah, because you just said something that I think is very important, is that talking to each other. We're talking to each other because currently we talk at each other.
Yes.
Yeah, we talk at each other, and that's not helpful.
Mm-hmm.
That's not, as we have discovered, that's not helpful. Yeah, so that probably would be a very great way to start, having classes together at the very least, at a very basic
Mm-hmm.
level, just having, you know, the same kind of thing together. What would you say? I've been asking this question now. What would you say if you had to describe the most essential quality of a nurse in just one word? What would that word be?
Presence.
Presence. Okay.
I believe, again, I truly believe in that blending of the art and science of nursing. And I think that, you know, you can go into a room and start an IV like it's another task that you've got to get through.
Yeah.
And move on to the next room and the next duty. Or you can go into a room and start that IV and look that person in the eye and smile. Right. And I think that nurses, our training and our hearts are really there. That's why we become nurses. Most of us become nurses because we want to make that difference. And I think that sometimes, especially in, you know, our current healthcare environment, you're right, everything is do. But if you think about it, oftentimes when you're confronted with palliative care or the patient that there is no cure for, that might be a child or it might be somebody's mother, right? Sometimes coming in and being comfortable just sitting for a minute.
Yeah.
That's the greatest healing gift you can give. And because as nurses, we're at that bedside 24 hours a day. We can bring our presence. And that's something that most professions don't have the knowledge or perhaps the time to do. You know, sometimes it's not what we do, it's how we do it.
Yes, exactly. And presence brings to my mind, just because so often our tasks, you know, are so, we have so many things to do that you walk into a room doing this but thinking about that.
Yes.
And it shows. So
it really does.
Yeah, we've got to get in the habit of being here when we're here. You know,
exactly, that be here now mentality. You know, I don't exactly remember the reference, but I read a study once that was done where physicians went into a room and spent 3 minutes with each patient that was participating in this. And, you know, one group went in and just looked at the chart, did their regular thing, looked up, asked a question, and walked out. And the others put down their charts and sat with the patient and asked the questions eye to eye. And the patients felt, even though it was the same 3 minutes for both groups, the patients felt that the physician that actually looked them in the eye and had the conversation, they felt that person spent more time with them.
Yeah.
They felt heard.
Yeah, that's the big word. They felt heard. That's the huge word. Because very often people don't think that we hear them. Yeah, so that's huge.
And oftentimes we don't hear them because we're busy. We're, you know, nurses right now, I think we're still in, a lot of us are still in what I would think of as Benner's novice to advanced beginner stage. You know, we're still so task oriented.
We're task oriented, right? Yes.
And a lot of that is because we have metrics to make, we have outcomes to to monitor, etc. But yeah, just, just making some eye contact and really just saying, how are you doing today? Or holding a hand for 30 seconds.
Yeah. And remembering that what is, I don't want to use the word routine because there's nothing routine about nursing, but what may be every day to us is a single episode in someone's life and huge.
Exactly.
Yeah. Ruby, I need to thank you so very much for doing this. It's been a pleasure. It's been eye-opening. It's been a whole lot of everything. You've given me some things to think about, actually, regarding my own self-care and my own approach to things, particularly the reference you made about boundaries not necessarily being hard walls. I hadn't thought of it quite like that before. But thank you for that.
Oh, it's been my great pleasure.
Thank you, Ruby. Have a really, really wonderful evening. And thank you so much. I really appreciate this.
Thank you so much, Dale.
Okay.
Take care.
All right.